Good afternoon, everybody. I hope you can hear me okay. My name is Michael Moore and I'm an SVI in Veterinary Public Health Implementation, and I'm going to just take you through a little bit about what we know or what we plan in relation to groupage and the organisation of certification. Like I've been in veterinary public health a long time, and groupage is something that we haven't really dealt with all that much in here, because most of the certification that we carry out or have been carrying out over the years has been large single container consignments to third countries like China, US, where Singapore, wherever, and there would be no such thing as picking up bits and pieces of the load along the way or whatever. So this is relatively new to us, but I'm not going to teach any of you who are involved in FBOs manufacturing or in logistics companies what groupage is all about, because you know an awful lot more about this than we do. But what we have to do is try and fit our certification work around this groupage element of the GB certification that we have to do. So this is something that is new to us. So for some of my colleagues who are may not be familiar with groupage, basically it's all about grouping together product for transport, grouping together goods dispatched by several different companies in the same load. An awful lot of smaller companies would not have enough product to fill a load. That's the whole issue, and of course there is economies of scale as well, so that the transport costs can be cheaper. So we have discovered that this is a large component of GB product movement, products of animal origin, that require certification, and therefore we're tied into this in a big way. There are 3 certification models in relation to groupage, and these are what we call, and GB also, the consolidation model, the sequential model, and the linear model. For the purposes of this discussion, I'm not going to talk about the sequential model because it's kind of a mix of the other two, and it involves things like certificates of non-manipulation from one pickup point to another, and we're not going to get involved in that, so we're just going to ignore it completely, and we'll talk about the other 2 models, the consolidation model and the linear model. So we'll start with the consolidation model, and the 2 models kind of look similar, but from a certification point of view they will be different. In the case of the consolidation model, in this illustration we have 3 pickup points, 2 of which are on the same journey and the other one is coming from a different direction, but that doesn't really make any difference. One is a mixed pallet, a pallet of mixed pizzas. The second one is 2 pallets of fruit yogurt, which these are all consignments that will require certification, and the third one is meat composite products. The issue here is these products are not certified at the point of origin. They will be certified at the consolidation center. But in order to be able to certify them at the consolidation center, the information associated with each, this background information, has to be passed forward to the consolidation center. The consolidation center, which either a logistics company or the cold store or whatever it is, will put the load together and then will apply for the health certificate on traces. The official veterinarian, there will probably be an official veterinarian associated with, or maybe even headquartered at the consolidation center, who will validate the health certificate, print, sign it, and then the container is sealed and off it goes. And I'm completely ignoring all the other things like customs and IPAFs and whatever else needs to be done. So the features of the consolidation model: multiple premises of origin, same as the other one. Consignment will be collected by the transporter and brought to the consolidation hub or cold store. This must be accompanied. Now, the background information, when we mean a company, that doesn't have to be with the load, but it has to get to the consolidation center some way. And this includes the origin, the treatment, and the slaughter dates if relevant for fresh meat. Consignments are then consolidated at the hub on a single container, and the container is sealed. And the export health certificates are applied for by the FBOs. Now, who exactly applies for the export health certificate? Maybe the consolidation center operator themselves, or it may be the FBOs of origin. That will be something that'll have to be worked out between them. And then the official veterinarian will validate the export health certificate once it has been generated on traces, and they will print it and sign it, and it will be then available to hand over to the truck driver. So the difference then, or the second model, the linear model, and for illustration purposes, it's linear on this, but it doesn't have to be. It could be exactly the same as the other one. The pickup points are the same, the products are the same, but the issue here is that at each point of origin, the product, the FBO at the point of origin applies for an export health certificate, generates the certificate, an OV associated with the pickup point will print and sign the export health certificate, and the pallet is sealed, or pallets. And then the second pickup point, the same thing happens. It may be a different official veterinarian that involved. The export health cert will be generated, OV signs it, and the pallet is sealed. So each of these pallets goes to the consolidation center sealed and with an export health certificate. So there's no passing forward of information associated with the load, because the export health certificate is already generated and printed. So that's essentially the difference between that and the consolidation model, where the export health certificates will probably certainly be printed and signed at the end. Who generates them is for discussion. So the features of the linear model are, again, multiple premises of origin. The FBO at the pickup point applies for the export health certificates and completes the consignment details. The official veterinarian associated with the pickup point validates, prints, signs at each point of origin, and then the export health certificate travels with the load to the consolidation center. And the pallet or pallets are sealed at the premises of origin, and my colleague will discuss sealing of pallets in the next talk. And then the load is consolidated at the hub, and the final container will probably be sealed there as well prior to dispatch to GB. So the question is, which groupage model is best and best means best from a practical point of view, how it's going to work out for certification. And this really depends. The linear model guarantees that each individual FBO's consignments will be certified at source. And that's probably what a lot of people would like to see. However, the linear model is very intensive on official veterinarian resources, because literally you need an official veterinarian attached to each pickup point. And that is something that is or could be very difficult to provide. But the consolidation model requires less OV resources, but the management of the traces, generation of export health certificates can be more complex at the consolidation center, because you have a lot of stuff coming in, and you are trying to generate individual export health certificates for each consignment, each consignee, each product type, all that. So it's very complex. But both models are likely to be used based on local resources. So we're not saying one is going to be used and the other isn't. I think both will be used. It will depend on as I say, what the local situation is, and we're not ruling any of them out. Trialing is ongoing of different ways of certifying, and we will consider the lessons that have been learned, both ourselves, and we will also be doing end-to-end testing with DEFRA, and we will share the lessons that we've learned with food business operators in due course. So thank you very much for your attention. And as I say, we can take questions at the end.